Living fully alive in every way. You're listening to Relationship Prescriptions with Dr. Carol.
Hi there again, friends. It's Dr. Carol, and welcome to Relationship Prescriptions. If you are a woman, or you care about a woman or love a woman, this podcast will help you. We're talking about mastering your hormones as a Christian woman. And I don't know that there's any woman who's older than maybe 9 years old who hasn't experienced some challenges around her hormones. There are very possibly some times when you feel like your hormones are driving you crazy. And if you're a man who cares about or loves a woman, you may think that the woman that you care about is crazy. But I want to help you know some ways that you can master your hormones, specifically as a Christian woman. Now, as an OBGYN and reproductive endocrinologist and a doctor of ministry, I see some interesting and amazing connections between this important and fascinating part about how God created us as women and how we can master that aspect of our lives in being better for the people around us, being better for the purpose that God has for us in the world. And so stay tuned for this program. 7 keys, 7 ways to master the hormones in your life as a Christian woman. I talk to women frequently about this kind of problem, the medical part of who I am and what I do. As an OBGYN physician, I see women going through these challenges all the time. There are 3 primary times during a woman's life when hormones and hormone changes seem to be especially important. Now, a hormone is nothing more than a substance that comes from one part of your body and goes to another part and signals a tissue or an organ to adjust its function, to do this instead of that. It's a messenger from one part of your body to another. And a lot of those hormones are something that our body needs every day in fairly standard amounts, like thyroid hormone or insulin or cortisol from the adrenal glands. What the hormones are that tend to cause women challenges are the so-called sex hormones, estrogen and secondarily progesterone. Those particular hormones from a woman's ovaries are the ones that go through such big changes in various seasons of a woman's life. And there are 3 primary seasons or periods of time when these changes become especially important. One of them is during pregnancy and after the birth of a baby. During pregnancy, the placenta is making enormous amounts of hormones, a lot of estrogen and progesterone and related hormones. Immediately after birth, when that placenta is delivered after the baby, those hormones plummet in a woman's system, and her ovaries are not ready to pick up again yet. So that period of time where the female hormones are at extremely low levels in a woman's system can make her very vulnerable to certain feelings and challenges. Women who breastfeed, there are amazing benefits both to mom and to baby when a mother breastfeeds. But in that situation, it takes longer for a woman's ovaries to start producing those hormones again. And for some women, that can even prolong some of the changes, that some of the, if you want to call it, side effects of that dramatic drop in female hormone levels. That is the trigger, for example, for postpartum depression and related things. Some new moms have major struggles with that. Thankfully, we know some really good ways to help. A second time in a woman's life when these hormone changes are especially important is right before a woman's period. Now, a woman who is having regular or reasonably regular monthly menstrual cycles, the hormone swings from day to day during the month are also very significant, most especially in the days coming up to a woman's period, those female hormones from the ovaries drop precipitously. And again, that precipitous drop in hormones for some women creates a lot of symptoms. And that's where we get women complaining about PMS, premenstrual syndrome, premenstrual dysphoric disorder, the both physical and emotional changes that many women experience during that particular time of the month. And then the third period of life that these changes happen is menopause. One of the unique differences among many between men and women is that the drop in hormones from the ovaries in a woman is so much more precipitous and dramatic than the drop in male hormones that a man's testes produce. So that unique period of time in a woman's life when her ovarian hormones are dropping so quickly can also create a lot of symptoms in some women. And during that transition, there's also much wider swings in those hormones. The monthly highs are higher, the monthly lows are lower, and then once menopause transition is completed, the ovaries are producing incredibly little, if any, hormones like they were just a matter of months or a few years previously. One of the things I hope you've heard in that really quick description is the emphasis on changes. The changing levels of a woman's reproductive hormones is what triggers these symptoms. It's not the absolute level of a hormone in a woman's body nearly as much as it is the changing in those levels from day to day, week to week. Those changes are what trigger the brain to respond in certain ways and trigger a woman's body to respond in certain ways, and so on. Certainly, high levels of reproductive hormones have a different impact on the body than steadily low levels, but especially when we talk about the mental and emotional changes or feelings or symptoms or struggles that women experience during these periods of time, it's the changing levels that impact the brain most especially. So now, 7 things to do in mastering your hormones. I have been talking with women about these issues now for between 25 and 30 years, going on 30 years. And we know some very practical and real ways where these symptoms can be managed. You do not have to be a victim to your hormones. And that is step number 1. Choose to be in charge. You are not a victim to your hormones. If you love or care for a woman who is struggling in these ways, you can help her understand that even though there are ways in which she may feel out of control, that there are practical things to do to manage these seasons of life, these symptoms. Hormone changes are not an excuse for bad behavior. Don't blame your hormones for lashing out at your husband, for example, or your kids or your coworkers. Now, you may have you may struggle to manage your feelings harder during those certain seasons of life, but they're not an excuse. You are still responsible for your thoughts, for your behavior, for your choices. So choose to be in charge. Choose your attitude. We know, for example, that in certain cultures, many of these symptoms are much less than in others. Take menopause, for example. In certain cultures, such as the Japanese culture, the symptoms of menopause are very minor compared to what the average American woman reports. Now, some of that may be diet, some of that may be other things in lifestyle, and we'll talk about that in a minute. But part of it, I believe, is the different feelings about aging, the different attitude about seasons of life and the value that you as an individual woman and those around you place on moving into different seasons of life. I remember one lady who was in her late 40s, and her periods were getting very unpredictable, and she had wanted a child. She came to see me as a OBGYN and wanted me to help her understand what was going on and see if we could help her get pregnant. We did some tests. She came back to see me to get the results of those tests, and I had to let her know that based on the tests that we did, humanly speaking, her ovaries would not be able to produce an egg to give her a child, that she was entering menopause, that she was going into that transition. She completely broke down. She actually ran out of my office and ran into the bathroom and dissolved in tears, just sobbing. After a few minutes, she came back and we talked further. But these are emotional aspects of a woman's life. You can choose how to respond at those times. You do not have to be a victim. You cannot always choose the circumstances around you. You can't even always choose the level of hormones that your body is experiencing. But you can choose how to respond to the feelings that you have. Your feelings don't mean you have to behave in a certain way. Choose to be in charge. Now, step number 2, make sure that your rest and exercise is optimized. We know, for example, that women experiencing premenstrual syndrome or menopause may have a great deal of their symptoms, especially the emotional, mental symptoms that they experience, completely eliminated or dramatically lessened by regular aerobic exercise. Running, jogging, swimming, cycling, brisk walking, active gardening, those kinds of things for 30 minutes most days may hugely change how you are experiencing these hormone changes. We can prove that biologically and with good research. We know too that if you are not getting adequate sleep, that your brain is going to be less able to manage the feelings or symptoms or challenges that you're facing. So make sure that your sleep and your physical exercise is optimized. A couple other ways in which exercise helps women who are experiencing these transitions. One is that exercise helps manage your weight. Now, there has been a lot of research trying to decipher through the menopause transition, what is it that brings many women to experience gaining weight? Is it the change in hormones? Is it the change in years? Is it simply getting older? If a woman chooses to take hormone medications, does that make weight loss more? Does it make it less likely that she gains weight? And there's been a lot of research there. The best evidence is that simply going through menopause does not by itself make your weight different. We do know that your metabolism as a whole changes in that season of life. Your muscles are not functioning as efficiently, and so they burn up fewer calories. Well, exercise can reverse almost all of that. Women who exercise regularly going through the menopause transition don't gain weight like those who don't do. It's much easier to control your weight. Less extra body fat means that there is less estrogen in your body because fat does produce some estrogen. And with that change, there's less risk of a number of illnesses, less breast cancer, less uterine cancer, and so on. And regular aerobic exercise also increases those feel-good chemicals in your brain. And you know that. You've heard that before. The endorphins and norepinephrine and all that, your brain gets a charge of those feel-good chemicals when you exercise. So if you are wrestling with emotional upset or hard to manage your feelings with some of these hormonal transitions, get some regular physical exercise. It may be a game changer. I have had patients where that is all they needed to do to change their symptoms dramatically. Step number 3 in mastering your hormones is eating a healthy, natural diet. Now, that should be a no-brainer, but just a couple things specifically about how that relates to your hormonal symptoms. Processed foods trigger changes that our bodies are not programmed for. Processed flour, baked desserts, white bread, donuts, croissants, those kinds of foods created with refined flour do a really bad number on your body and your brain. It's just like dumping sugar into your system. And we are all aware of the sugar high. If you eat a lot of sugar, the blood sugar raises quickly and your brain gets a rush and then it crashes and you feel terrible and you want to eat more and it makes you more hungry. And that vicious cycle impacts both your emotional well-being and your body fat. All that insulin that's getting pumped into your body stores all that blood sugar in your fat cells. Well, the refined flour, white flour, does exactly the same thing. Your body really doesn't know the difference between white flour and sugar because it is immediate. That white flour is immediately changed into sugar in your body very quickly. That is very different from whole grains, very different from vegetables, very different from many fruits. Most people can incorporate whole grains into their diet and do extremely well. There is actually some research showing that adding whole grains to your diet can actually lessen the risk of a number of diseases, where that's just the opposite with refined flour. Then, of course, there's all the chemicals, the preservatives, and so on that is in processed foods. If it falls from a tree, if it grows from the ground, you can be pretty sure it's quite healthy. Choose food that is as close to the way God made it as possible. Protein, there is a whole debate about vegetarianism, veganism versus eating healthy meat. That's a separate conversation. Either can be healthy. Make sure you get some healthy protein each day, whether that is from organic meat or whether that is from beans and peas and legumes, avocados, healthy fats, all of that your body needs. Pay attention to what you take into your body. Step number 4, consider supplements very carefully. I know that in the women I talk with, the majority of them who are wrestling with hormonally related symptoms, who feel like they're going crazy with their hormones, have either considered or are already taking supplements. This is a situation where I have to say, buyer beware. The supplement industry is not regulated like medications are. Now, I have a love-hate relationship with the Food and Drug Administration because I don't believe that they always make choices based on how they should be made. However, they are the best we have at knowing that the medications we have available are safe and effective. Do they sometimes get it wrong? Yes. But there is no such regulations about the supplement industry. And just because a substance is natural does not mean it is safe. For example, plant estrogens, phytoestrogens, may have many of the same dangerous effects on certain body tissues as synthetic estrogens do. just because something is natural does not mean it is safe. So be cautious in making those decisions. I will tell you that the only supplement I take is called JuicePlus. You can consider that as fruits and vegetables in a capsule. It's a phytonutrient supplement, taking ripe, whole fruits and vegetables, removing the blood sugar, and just getting the phytonutrients there in a capsule. I'm going to make sure that the link to that is in this episode's show notes in case you want to find out a bit more. Some women going through menopause may find some help with black cohosh. There's some pluses and minuses to that. If you have any risk of liver disease, there's been some reports about the impact of black cohosh on liver, so you may want to be a little cautious there, but that may be helpful. I also want to mention St. John's wort. Any mood swings, any depression, especially for women going through menopause or at some of these other times, St. John's wort may be very effective. It may be as effective as many of the antidepressant medications that people are prescribed. So it's something to consider, at least think about. Step number 5, get a medical evaluation. Even if you are experiencing hormone changes, that doesn't automatically mean that there's nothing else going on. It is absolutely wise to get checked out to see if there are any other medical conditions that may be leading to your symptoms. For example, women going through menopause may have a lot of fatigue. They may have trouble sleeping. There may be other things going on at that time of life besides the changes in their reproductive hormones. Thyroid dysfunction is fairly common, and a simple blood test can detect that. Anemia is not uncommon, especially if a woman has been having heavy, irregular periods during that transition. And there's also things like checking kidney function and liver function and just some of the basics. Checking heart function. Is your heart having any trouble? That can lead to fatigue. That's just one example. So for whatever symptoms you're experiencing, it's appropriate to get a medical evaluation and just see if there's any other reasons for the symptoms that you're having. Many women who are going through these transitions can be helped by low-dose natural hormonal medications. Now, there's a lot of controversy about this in many circles. I will give you my perspective as a reproductive endocrinologist who has treated women with these conditions for many years. I believe that many women going through menopause can be helped by replacing the same estrogen molecules that her body was taking that her body was making in the past. There is FDA-approved medications available using estradiol, the same estrogen that was there from your ovaries in the past, that has a different response in the body than synthetic estrogens. I'm not sure there's any place for synthetic estrogens in today's medical treatment. I could potentially be proved wrong, but I have yet to find a patient that could not be helped with these natural hormonal molecules that are just what your ovary was producing in the past. Progesterone, if a woman has a uterus in place, is also necessary. So it's something to be thoughtful about. In the majority of women going through menopause, the risks to using these medications are much lower than the potential benefits. Now, it's not across the board. Not every single woman needs or should be taking these. But if you are struggling with symptoms during these periods of time, ask your doctor about it. It's worth checking out. It's in many cases an appropriate choice. So step number 6, use your support system. You don't have to go through this alone. You are not the only woman to experience the symptoms that you're feeling. We know, for example, that new moms shortly after having a baby that are experiencing postpartum depression and all the other stresses that a new mother almost always experiences, that their postpartum depression can be resolved in many cases by connecting with other new moms. And support groups for new moms can make a big difference in clinically measured symptoms of depression. Now, there are certainly exceptions where other treatments are necessary, but we know that support can make a difference. Going through PMS, if you are married or if you're trying to work, enlist those around you to help you. For example, if you know that, okay, here are a few days where I'm going to struggle to manage things better, let your husband know that he's not the one bugging you. Give him the option to hold you accountable. Don't accept bad behavior. Help you find ways to manage the stress that you're going through. Hey, why don't you take a nap? Or how about I cook dinner tonight and, you take a break and let's just sit and talk, or whatever it may be, to enlist support in helping you go through these seasons of life. Get together with other women. Hey, we all experience various dimensions of this at various times. Don't try and do this alone. Get together with some girlfriends. Enlist your support system. And then, of course, there are professionals. Don't be afraid to reach out for some extra support. I have a friend who has worked with counseling and coaching women for several decades. She's semi-retired now and only works just a very few hours a week. But as she and I have talked, she said that during the menopause transition, women going through that season of life, that seems to be perhaps the most frequent time when they feel the need for some support. And it may not necessarily only be things that are going on right now in menopause. This season of life may bring up memories or old traumas that need to be healed or old relationship issues that haven't been addressed. And of course, there are many other things going on in that season of life. Maybe empty nest syndrome. Maybe there's some changes in your career going on at this point. Maybe there are aging parents that are adding to your stress, and it's appropriate to get some professional help if you're not doing well on your own. And then number 7, stay spiritually fit. I mentioned earlier in this episode that a woman's attitude about what's going on in her life makes an enormous difference. Just from a psychological standpoint, staying connected with God is important. But so much more so, of course, from a spiritual standpoint. When we go through these life transitions, or if hormonal changes are making you feel crazy, there's some dimensions in which that lowers our defense mechanisms and unresolved stuff comes to the surface. You can see this as an opportunity to invite God into some of those messy places. Maybe there's some issues around fear or guilt. Maybe there's some areas you need to receive forgiveness from God for, or even extend forgiveness to someone else. And when you are feeling vulnerable, a great step to take is to enter God's presence and invite Him to help you understand. When your mind is swirling and your body feels unsettled, it can be so easy just to grit your teeth and your thoughts swirl and you're trying to figure things out and make things better and nothing's happening. It's just getting worse. It's important to slow down, to get quiet, to get into God's presence and let Him help you understand. Let Him speak to you about what is going on. Most of the time, God does not shout over a cacophony of sound in our heads. Most of the time, He waits until we get quiet. And it's in those quiet moments when he can interpret things for you, when he can show you what next step to take. That will make a difference for you too. So, a quick review, 7 steps to mastering your hormones as a Christian woman. Number 1, choose to be in charge. Don't allow yourself to be a victim. Choose how you respond. Number 2, optimize your rest and physical activity. God made our bodies to go through seasons of rest and to be physically active. You will be much more resilient with regular physical exercise and an appropriate rhythm of rest. Step number 3, eat a healthy, natural diet. Choose food that is as close to the way God originally created it as possible. Your brain and your body will both thank you. Step number 4, consider supplements carefully. Remember that just because something is natural does not mean it's safe. Consider JuicePlus. Again, that link is in the show notes in case you'd like to consider what I take. Step number 5, get a medical evaluation. At least get checked out to see if there are other reasons for the symptoms that you're experiencing. Step number 6, use your support system. Your spouse, your friends, your coworkers, and professional help if you need it. And step number 7, stay spiritually fit, stay connected, get into God's presence, get quiet, and let Him speak to you. I hope that's been helpful. Whether you are a woman who is feeling the pressure of changing hormones and struggling there, or whether you're someone who loves and cares for a woman in that situation. 2 resources that I want to talk with you about. One is my book, Dr. Carol's Guide to Women's Health. We'll put the link to that in the show notes. I unpack all of these things in a lot more detail in this book, Dr. Carol's Guide to Women's Health. This book goes through all the seasons of a woman's life, from childhood and menarche starting to go through adolescence, all the way through senior menopause transition and health as a senior, all in between, looking at the physical, emotional, and spiritual dimensions of a woman's life in these various seasons. So consider checking out that book. And then the second resource I want to invite you to is our online community, the Fully Alive group. The month of September, this month, in the Fully Alive group, we are diving deep into our physical wholeness. Now, in one of our first teachings this month, I'm unpacking this whole area of hormones and so on in an even deeper level than I can do here. We're talking about a theology of the body, looking more in depth at what the Bible has to say about our bodies, and then unpacking that specifically when it comes to hormones and both men and women. We'll also be addressing healthcare costs. We'll be addressing nutrition in a specific online event. If you are interested in getting healthier, especially as a believer, and bringing the best self that you can physically to the purpose for which God has you here, then you need to be in the Fully Alive group this month of September. Now, if you're listening to this podcast the first day it comes out, we have an online event this evening, September 3. FullyAliveGroup.com. I invite you to come be a member and join us there. If you're listening to this podcast later, and you become a member, you will get access to all the recordings from our previous online events, all the information and data, the videos, the tip sheets, everything that we make available. You can see, even if you are listening to this and become a member a little later after it first comes out. God has a fully alive life for you. That's our premise in everything we talk about here through Dr. Carol Ministries, and in the Fully Alive group, unpacking the specific dimensions of that. You don't need to feel alone, and you don't need to feel stuck. So take advantage of that. Check out the show notes, fullyalivegroup.com, and I would love to see you there. Thank you so much for being a member of our online family. If these episodes are helpful to you, I would love you to tell a friend about it. That means so much to me. If you share these podcasts or tell a friend or rate or review it in iTunes or wherever you listen to your podcasts, I keep you on my heart. I pray for you every day. And until next time, may God bless you.
Thank you for listening to Relationship Prescriptions with Dr. Carol. Our purpose is to provide trustworthy resources that help you and others live fully alive in every way as God intended. If you would like to help others experience transformation in their lives and relationships, we invite you to partner with us. Text the word GIVE, that's GIVE, to the number 512-980-1620. Or visit our website at drcarolministries.com/donate to make a one-time contribution or monthly gift. Your financial support allows us to expand our message and to help others. Thank you so much, and may God bless you.